Hello everybody, I'm Captain Jonathan Klein, Commanding Officer of Naval Support Activity Hampton Roads. I'm here with episode number 20 of Q&A with the Captain, our weekly video series during the COVID pandemic to keep you informed about what's going on and connected to the command. So we've got a couple of questions this week to go through. First one, when are we going to be out of Health Protection Condition Charlie? Well, as we've previously discussed, we continue to monitor the local health conditions and case trajectories and work with our Public Health Emergency Officer to make a recommendation to the region commander about whether or not we're ready to downgrade from Charlie to Bravo. There are a couple key things that we monitor. If you receive this video link via email, I've given you the latest update in the email of those factors. But number one is a 14-day downward trend in COVID or influenza-like illnesses, the symptoms of those. Next is a 14-day downward trend in the number of cases that are reported. We have case positivity, testing positivity less than 10%. And finally, it's the new cases per 100,000 people per week. And the Health Protection Condition Charlie threshold is 50 new cases per 100,000 people per week. So as of this week, we have seen progress in those areas, particularly with influenza and COVID-like illness, as well as a number of new cases. But we're tracking 15 health districts here in the Hampton Roads area. 5 of those 15 are still above 10% positivity on the tests, which is actually an increase of 1 from last week. And 12 of the 15 are above the 50 cases per 100,000 threshold, which is steady from last week. And in some cases, they're significantly above that threshold. So for this weekend, and probably in my estimation in the next couple of weeks, we're going to stay in Health Protection Condition Charlie just based on those conditions. That does impose some limits on our sailors, and we ask our civilian personnel, family members, and contractors to comply with those same restrictions to make sure that we keep the force safe and protect our sailors and our ships going to sea. So, question number 2, also related to COVID, is there a technology solution that will help with contact tracing or let me know if I've been exposed to someone who's diagnosed with COVID? So this is a great question. With all the technology we carry with us every day, I really think it seems like we should be able to use it to help keep us safe. So as it turns out, there are a couple of options. The first is the Virginia official COVID app called COVID-Wise, COVID-Wise. It's available on the Google Play and Apple app stores. So the way it works is it uses anonymous keys, and this is going to get a little geeky and techie, but anonymous keys exchanged between phones over Bluetooth low energy. And so it doesn't connect any personal information, it doesn't collect any location data, it doesn't store any of that. But it uses that Bluetooth exchange of these keys and the signal strength of the Bluetooth to determine how close you were to someone for how long, and then it goes back to the CDC guidelines of 6 feet for greater than 15 minutes as sort of the exposure limit. So it tracks those keys, it keeps a history of that for 14 days, and then if you or someone else is diagnosed COVID positive, they go into the app, they report that positive, that goes to the Department of Health to confirm that you actually have a positive diagnosis, and then they give you a PIN to enter so that you can sort of be a verified COVID positive. And then through those anonymous keys that are exchanged, everybody who has the app installed on their phone will get an alert that says you've been identified as someone who is in close contact with a COVID positive. And then it's up to the individual receiving that alert to take steps to contact their medical provider, contact their supervisor, and take the appropriate procedures to quarantine themselves due to that exposure. We're going to include a link. I'll have it in the email. If we can put it on the YouTube channel, we'll have the link to their frequently asked questions. It seems like it's a pretty good app. I'm using it myself. I have been for the last couple of weeks since they rolled it out. And I really encourage everybody to consider incorporating the technology solutions that we have to try to accelerate our understanding of the spread of COVID. There's another one out there called Novid, N-O-V-I-D. Similar, it doesn't track personal data, it doesn't track location, but it uses ultrasonic instead of using Bluetooth. And it's, if you go to the website, you can find the sort of the Gucci description of how that works. I'm using both of them, mostly because I feel like the more people that use them, the more widespread it is, the more likely it is that you will get notified or know that you've been in contact or proximity to someone. So these things don't work if we don't have, there's not some sort of critical mass of users of it. So I encourage you to do some research, but COVID-Wise is the official Virginia app, and it is used by the Virginia Department of Health. So I encourage you to look into those options. I think it will actually really help us as we're trying to figure out, quarantines and isolation due to exposure. So next question, what should I be doing to get ready for hurricane season? I think this question might have been planned from our emergency management officer, so thanks, Tim, for that. So it is a great question, another great question. So we're still in the middle of hurricane season, and just some statistics from 2019. It was the 4th in a row of above average and damaging hurricane seasons, more than 15 named storms, more than $50 billion in damage, and 172 deaths. In 2020, the season is shaping up to continue that trend. So a couple of things. It's the first Atlantic hurricane season on record with 9 tropical storms formed before August and 13 formed before September, and 7 that have made landfall in the U.S., all records. Our first 2, Arthur and Bertha, actually formed before hurricane season actually started. And Hurricane Laura, that hit the Gulf Coast last week, was the strongest tropical cyclone on record in terms of wind speed to make landfall in Louisiana. So already a very active season. Probably should expect to continue to see that. I know there, when I looked at the weather this morning, at least 3 tropical systems in the eastern Atlantic and moving towards the Caribbean. So I tell you all this to remind you how important it is to be prepared and have a plan. So as it turns out, September is National Preparedness Month. We're encouraged to take steps to prepare for emergencies in our home, places of work, and our communities. And this year's theme is Disasters Don't Wait, Make Your Plan Today. So there's a lot of resources and tips out there. Folks who have lived in hurricane-prone areas probably have second nature preparations they make. But if you're new to this or you just want some additional information, the Ready Navy website at www.ready.navy.mil is available, and there's also ready.gov. And these links will provide you a lot of information on how to prepare for a storm and hurricane kits and the like. So our last question, this is a tough one. So what are the Navy and the command doing to address concerns about racial divisions and social justice? There continues to be a lot of anger, frustration, confusion, and pain in the community, in the command, and in the Navy surrounding the incidents that have occurred around the country. So most recently, the shooting of Jacob Blake in Kenosha, Wisconsin last week. We had the shooting of Dijon Kizzee in Los Angeles this week, and there's the ongoing protests in Portland, and certainly activity spread around the country. I don't know any magic solutions, and what I do know is if we have any hope of making progress, if we want this to be a moment of change, then discussions about racism, social justice, and police brutality, they need to continue. They need to continue in the command, in the home, in the neighborhood, in your social groups. And so the Navy has established Task Force 1 Navy. They're proactively conducting focus groups across the Navy. And we actually have Lieutenant Commander Davis, our officer in charge at Northwest Annex, is personally involved in this effort and with the focus groups as a recorder for them. And so we do have an avenue. If you've got thoughts or ideas or concerns, you can contact her directly, and we have a direct line into the Ready Navy Task Force. They're looking at everything from recruiting to training to qualification to advancement, trying to make sure that there's no implicit or explicit bias in our processes. So from a big Navy perspective, that's what's going on. Here at NSA, we can't control what goes on in the rest of the country. We can't control what goes on in the rest of the Navy, but we can control what happens here in the command, and we can be, every one of us, part of the solution inside this command. And that's what I expect. I think that's what we all expect of each other. So I've talked to some folks over the last couple of weeks, and I think that we need to all take a step towards making these very difficult conversations just a part of our engagement with each other. We've done it with sexual assault. We've done it with suicide. We do it with drug and alcohol awareness. Those were topics that were very hard to break into mainstream conversation, to address destructive behaviors, to address those things that undermine effectiveness, that hurt people, that can have a negative impact socially and emotionally. And this is the same. So racism and social justice has to be part of something that we become comfortable talking about, so we understand the impact it has on our coworkers. We understand how it undermines readiness and how it undermines their folks' ability and willingness and desire to come to work. I pledge to you that in my workplace, to the extent that I can stamp it out, it is not tolerated at NSA Hampton Roads. But I need everybody's help in making sure that message is understood, and I need everybody's help in making sure that in your environment, in your office, in your workspace, it does not exist, and when those things come up, that it's challenged when it does. So I'm asking everybody to take care of each other, right? And you know, so these times with COVID, with the social unrest that's going on, you know, everybody's dealing with these challenges, and they're personal, and they're physical, they're emotional, they're professional, they're financial. Add in the strain of virtual schooling, and really it's a challenging time for us all. And you know, I was reflecting on I did INDOC class this week. I was reflecting on our guiding principles, and one of them is compassion. So if you've sat through my INDOC lecture, you've heard that, and it really you know, reemphasized to me the need for compassion right now for our families, for our shipmates, and really the idea of how do you embody that, how do you do that, and so I think it's that you can't be afraid to reach out to people. You can't be afraid to make that phone call or FaceTime or Zoom and just ask how someone's doing, and really mean it, really want to listen. If you're personally feeling those challenges, let your chain of command know. Reach out to your supervisor and just let them know that you're challenged, and regardless of what it is. And we can't solve everybody's problem. We can't solve every problem, but we can help. And there's so many resources out there. You know, specifically our Fleet and Family Support Center. So everybody has been impacted by COVID and availability, but Fleet and Family has done a great job of making sure that their services are available. So they're still providing counseling. They're still doing suicide prevention services, domestic violence intervention, financial counseling, budgeting, new parent support, helping transitioning service members. Exceptional Family Member Program is still going, sexual assault response program. And so if you need that support, I encourage you to reach out. You can go online and find it, or you can just call. So Portsmouth Annex at 953-7801, Northwest Annex at 421-8770, and then the Fleet and Family on Hampton Boulevard, which falls under Naval Station Norfolk. It doesn't matter what base it belongs to. It's Fleet and Family support for the entire Navy. And they can be reached at 444-2102. So please, everybody, take the time to look out for yourselves and look out for your shipmates. So, you know, as we head into the Labor Day weekend, I know everybody was probably hoping to be able to go out and do a little bit more, and that we to be a little further along in our fight against COVID. But we are where we are with that. So still, you can take some time to recharge your batteries. For the parents out there, you know, prepare for that first day of virtual school. It is going to be challenging. And until next time, of course, wear your mask, wash your hands, and stay safe. Thanks very much. Captain out.